Hey everyone, welcome to today's podcast, the Powered by Iron Health podcast. We are here at Wellness and Pain in Ardsley, New York. We're going to be interviewing Dr. Arad, who is the founder of Wellness and Pain. It's going to be a really, really cool podcast. They are working on everything from veins to pain to IV drips, and their local small practice. So check it out, and if you like it, please share. You do not want to miss this one. Thank you. Hey everyone, welcome to today's podcast, the Powered by Iron Health podcast, where we're trying to create a community that raises the standard of health and wellness. Today we are at Wellness and Pain with Dr. Jonathan Arad. What's up?
Hi, how are you?
Good, how are you?
Good, doing well.
Thanks for doing this. This is going to be a good time. You know, you and I have a history and we can relive that and we could talk for hours. So
absolutely. Thanks for having me.
Yeah, for sure. So I always like to start with your story. How did you get to do what you're doing now?
Wow, so interesting journey. So after I kind of finished training, I went through a couple of practices. I kind of saw what was the right things to do, what were the wrong things to do, and I decided at some point that I was going to just start my own practice. Along the way, I'm a surgeon by background. I'm actually bariatric trained as well, so I was doing weight loss surgeries, robotic surgeries, all different types of surgeries. And over the years, we had a lot of patients come to us for a variety of things, and so they started to open up and express a lot of other concerns that existed as well. Things like sleep apnea, snoring, leg cramps, pain, this and that. And so along the way, we kind of reinvented ourselves, and Wellness and Pain was born because we realized there's a lot of people who are not taking care of themselves. They're in pain. They don't know where to go. They don't know what to do. They look online. There's 4,000 listings. They don't know who's who. And so we just started to realize that there's a huge need out there for a lot of other stuff. And so that's really where it came. And we kind of developed it over. We're still in development. We constantly are, adding services, just kind of, we listen to the patients. And if there's a commonality and there's a need for things, then we kind of listen and we say, you know what, maybe this is a good service to provide.
That's awesome.
Yeah.
When you were first becoming a surgeon, like what led you to that path? Like did you always know you wanted to be a surgeon?
Yeah. I mean, my father was a doctor, I fell into the path. He was in the ER. I loved being there.
You like being in the ER?
I love being in the ER. Yeah. And for a long time, it's exciting. When I went through training, I just knew that I wanted to be in the OR, operate, help people surgically. And it was just, it was a great experience. I love it. I still love operating. It's fantastic. It's kind of the immediate reward, so to speak, with surgery, versus these prolonged medical conditions that can take years. It's kind of like you operate on someone, you kind of see immediate effects. So there's this inherent reward that comes both from patient and for myself as well. So I always knew I wanted to do that. The technology involved constantly, changing and stuff like that. It's a very cool field.
Very cool. Yeah. Where'd you go to school?
I went to Cornell University undergrad. For medical school, I went to a Columbia University medical school in Israel. I had family in Israel and stuff like that, so I thought it would be a great experience. It was amazing. And then I came back and I did my residency training in Maimonides in Brooklyn.
Oh, nice. That's where I was born.
Oh, really?
Yeah.
That's amazing.
How funny is that?
Yeah. Very, very busy hospital.
Yeah. So you got a lot of hands-on bodies.
Insane.
So when you do your residency, though, like for surgery, you have to do all types of surgery, right?
Yep. So you rotate through different things. You do everything from general surgery, so gallbladders, appendixes, colons, to trauma. You do breast surgery, you do plastic surgery, you do vascular surgery. So you're exposed to pretty much everything in those 5 years. I mean, you do thousands and thousands of cases.
Okay. And then from there you went to bariatrics. That was why'd you choose that?
Along the way, because you're rotating through the different specialties, everybody kind of finds their path, so to speak. So you kind of like what you like and you don't like what you don't like. I did my fellowship in bariatrics. I liked it. Again, it was in the space of wellness kind of a thing. It's nice to see people kind of change their lives in a way, right? If someone really sticks to the program, which is part of the difficulty with bariatrics, to be honest. If they stick to the program though, and you are giving them a good result, it's a life-changing experience. I mean, from a mental standpoint to a physical standpoint to just their lifestyle. You know, you see people who can now run with their kids. It's just, again, it's rewarding. And so I thought it was a great thing. The surgeries are just fun to do as well, to be honest. They're very cool surgeries. The technology has evolved dramatically. I mean, you know, it used to be open bariatric surgeries that would be 5 hours, people in the hospital for 3 weeks, huge complications. You do it laparoscopically, the incision is this big, takes me 35 minutes to do. They go home the next day. And so again, it's just fun stuff as well.
Are you still doing that or no?
I still do bariatric surgery. Well, what's interesting is there's been a lot of evolution in the weight loss world. And so I can still do sleeve gastrectomy, which is probably the most common. We could do bands if needed. They're kind of fallen off a little bit.
Okay. What would be the difference for like a layperson to understand that?
So a sleeve gastrectomy they're both laparoscopic surgeries. So they're small incision surgeries are minimally invasive. You have to qualify. So it's all based on body mass index, BMI. So you have to have a BMI of 40 or more, 35 with a comorbidity. And so it's insurance driven, but basically diabetes, high blood pressure, sleep apnea kind of thing. And a sleeve basically entails removing the outer part of the stomach. So you're turning the stomach from a football to a banana.
Okay.
And so the idea is by removing that top portion of the stomach, you're having restrictions. You can't eat as much, but you also have hormonal control because there's a hormone called ghrelin, which is your hunger hormone. So it's lunchtime, I'm hungry. That's your stomach telling your brain that you're hungry. By removing that portion, you're just not as hungry anymore. Works unbelievably well. If someone came to me and said, what bariatric surgery should I have? I would say sleeve every day of the week. A band, but it didn't come into real world practice probably until 2010-ish. It was like the beginning stages of stuff. So before that, the only two options were Roux-en-Y gastric bypass, which is a very big surgery. You're basically cutting the intestine, you're turning the stomach into an egg shape, you're rerouting everything, or a band. And a band is basically a foreign device that goes around the stomach. There's a tube that goes to a port and you adjust it. And by putting more fluid in there, you're squeezing it almost like a belt. And it's a good option. The problem is, you know, for most people at some point the band fails. And so it's okay. But most people have kind of gone the sleeve route.
Interesting.
But the medications that now exist in the bariatric world, or the weight loss world, I should say, have really, I think, changed the game also. So there's medications like Saxenda and Wegovy and all these other ones that now are daily or even weekly injections. They're very easy to do. And honestly, people have lost 60, 70 pounds just on the meds. Yeah. So I think it's changing the weight loss world. So the bariatric surgeries, which are good for patients, you know, have, I think, decreased dramatically. I don't have the statistics, but at least, you know, in our area, you could see people doing well. And if, you know, my opinion is if you don't have to operate on someone, even being a surgeon, if there's a medication alternative that works just as well, hey, good for patients.
Yeah, for sure.
Yeah.
Does that also affect ghrelin? Ghrelin sounds like a hungry hormone, right?
It's a hungry hormone. So they all work on what's called GLP-1. They're GLP-1 agonists. So the whole idea is, if you imagine when you eat, there's an ocean. It's called peristalsis, right? So there's a wave that goes from your esophagus to your stomach to your intestines. And so this, in essence, kind of slows that wave down. And so by eating a small portion, you feel like you ate something very big because it's just not moving. And so you feel it sits in the stomach longer. The stomach has something called stretch receptors. So the more it stays stretched, your brain thinks that you're full. So you're not eating as much. It works really well. I mean, I can tell you there's not a lot of side effects to this thing. You know, there's a few kind of warnings out there that we always go through patient by patient. Obviously, it's very tailored. But in general, you know, the biggest two are nausea and vomiting. But that's really more so if patients kind of go through medications too quickly. The nice thing about the medications is if you don't like it, if it's causing problems, you can actually just stop it. Unlike the old school oral ones where it would cause palpitations, your heart's coming out of your chest, profuse diarrhea, things like that. These really don't have a lot of side effects. So people really, really do well with it.
Is this similar to What was like the drug that everyone was talking about for diabetes?
Yes, Ozempic.
Yeah.
Yep.
Is it the same concept?
Same concept. So Ozempic, Trulicity, Saxenda, Wegovy is a big one. There's another one, Mounjaro is coming out now. They're all basically, they were diabetic medications at low doses. And what they found is when diabetics took higher doses, they started having weight loss. So it's and they started to tailor it out. There's different indications. So for like Ozempic and Trulicity, you have to be diabetic versus Saxenda and Wegovy, you don't have to be. So it kind of opened it up more for people who are like, hey, what about me? I'm overweight, but I don't have diabetes. That's I need help as well. And so there are medications for many people.
Is that people like is there still metrics to that? Do you have to be obese?
Yep. So there's a BMI requirement. In general, it's 30 and above instead of 40, or 27 with a comorbidity. So it does actually qualify a lot of people.
Interesting.
Yeah.
I feel like that's game changer. I didn't know about the other two you said. It's like
it's a huge game changer. And so we put it as part of wellness. So, we are developing a men's wellness program and a women's wellness program. Weight loss is obviously a big part of it. And so, people will come to us because it's affects a lot of things in life.
Yeah, that's great.
Yeah.
So that was, your first thing here was the bariatrics.
Yep.
And then what was the next evolution?
So after bariatrics, again, people would come and say, hey, doc, my legs hurt. And I'd say, well, okay, I'm a bariatric surgeon, so, let's talk about it. I'm having trouble sleeping, I'm overweight and I'm having sleep apnea. Okay, so normally what would happen is we would refer these people to vascular. We would refer them to pulmonology. We'd refer them out to different stuff. And at some point they said, no, doc, I want you to help me. And I said to myself, you know what? Why not? Right? And so we started developing programs along the way. So really after that, started to come into the IV therapy world and the vein world, so to speak. We started doing ultrasounds in the office. They're quick, they're minimally invasive, they're very easy to do. And we found a lot of people had venous insufficiency. And once that kind of got out there, it wasn't just the bariatric population. It started to bring family and friends. And so all walks of life, we started to realize how many people had issues. And so now we do a ton of ultrasounds. We find a whole host of people with venous insufficiency, and they have cramping and throbbing and heaviness and sciatica and knee pain and all this other stuff, and we find a source. And so it kind of expanded to the non-bariatric population as well. And the same thing with IV therapy. People would come in. It started off really because post-bariatric surgery, if you can imagine, you can only have little amounts, especially at the beginning, because it's like a 6-week course of getting back to a regular diet. Obviously there's restrictions, but you can only have 2-3 ounces every couple hours. So they would have trouble. They'd get dehydrated. They would need IV therapy. A lot of these people would seek sources. So we said, why not help our patients? So we started doing IV therapy, and along the way it expanded obviously into the non-bariatric population as well. So we do IV therapy. We've made it very, very, very safe. So we've taken out things like potassium and magnesium that can cause, problems with people with heart issues or kidney issues. We've made it extremely safe. It's vitamin C, vitamin B complex, B12, and glutathione, which is an antioxidant. And so now we have people coming regularly to our office just for IV hydration.
Interesting.
Yeah.
So that would be the ideal person for that, is someone who exercises vigorously,
Yep.
or who else would be?
Yeah, it's if you're feeling, if you're exercising vigorously, if you're athletic. We have a lot of firefighters who come in because they're losing, fluids just from being around heat. We have people like myself who just drink way too much coffee and don't drink enough water, right? I mean, if you think about the amount of water, most people are not abiding by the recommendations out there.
There's water in coffee, right?
There's water in coffee. Yeah, it's good enough. But yeah, so we've kind of expanded to a whole ton of people. And so if your tongue is dry, right? If you're noticing that your urine is more concentrated, if you realize that you're just tired, people come and they get this IV therapy, and it really, really does help. So, I kind of evolved with it. I just said, hey, let's try this, and talk to patients, say, what do you think? You like it? It works for you? great. Let's start kind of expanding it. And it really worked out well.
Yeah, that's awesome.
Yeah.
And it seems to be a nice trend too. The whole wellness thing. I like that story. You're helping people who are overweight get healthy.
Yep.
Now it's going into the IVs.
Yeah.
The vein question I had was, you said venous insufficiency.
Yeah.
Now, how would you define that to someone who has no idea what that means?
Yeah. So veins are very interesting because when most people think about veins, they think about cosmetic, they think about female, they think elderly, and they think that they have to see veins popping out of their legs, which we can help with all those. So we can fix varicose veins, we can fix spider veins. But there's a whole huge section of the population where you don't see veins coming out. They're 35, 40 years old. It's equal in men and women. And it's not a cosmetic thing. It's actually a symptomatic thing. So what happens is people will start having heaviness, cramping, restless legs, throbbing, swelling. It could even be knee pain, hip pain, foot pain, sciatic pain. And it's because the veins are normally straight. So if you imagine the veins as like a tunnel, if you will, they're normally straight and they have these valves that help push the blood back up to the heart. So when the heart beats, oxygen nutrients go to the rest of the body through the arteries, supplying all our organs, our body. That gets used. So you have deoxygenated blood that now needs to be recycled back to the heart. That's really the job of the veins. What happens over time is just life happens, gravity wins, and genetics, age, standing a lot, sitting a lot, pregnancy, obesity, lifting, all those things put pressure on the lower bodies. And veins are not built like arteries. They don't have strong, thick walls. They're very soft. And so over time, that wear and tear causes the veins to dilate or stretch. When they stretch, because those valves are attached to those outer walls, they get pulled apart from each other. So the valves can't push the blood back up to the heart anymore. Gravity wins. And so what happens is the blood sits there and pools in the legs. That deoxygenated blood has oxidants in it, which you don't want. And so that those oxidants seep into the tissue because they can't go up. They just sit there and they pool into the subcutaneous tissue and they cause tissue damage. And that's what venous insufficiency is that the veins are insufficiently returning the blood back to the heart. People also commonly notice skin discoloration of their legs. They'll notice this can, in a certain population, lead to ulcers. And so you can start seeing people with purple, gold kind of colored ankles. A lot of people start to notice it. But people are just unaware of this. There's a huge awareness problem with this. And so the statistics out there are something like, 80% of the population at the age of 40 has this and 5% has been treated.
Wow.
Because they just don't know. You have knee pain, you go to orthopedics. Okay. You have foot pain, you go to podiatrist. Fair. Nobody says, I have leg pain, I'm going to the vein person. Because they're thinking as cosmetic.
Yeah.
That pressure, though, is what causes a lot of people's symptoms. Now, it also causes varicosities, the veins that do come out of the legs. That pressure, that same venous insufficiency is the cause of varicose veins and spider veins. So it's all one common denominator. So the ultrasounds that we do in the offices and we do at events, and we go out there and we do wellness events, are 8-minute scans. It gives us information immediately. And if patients have venous insufficiency, which we see very commonly now, we can actually give them their treatment options.
It's very cool.
Yeah.
And very well described.
Cool.
So thank you for that. So the first symptom really is them seeing discolored. Like, what would you say if someone's listening who?
No, the first symptom is I would tell people listen to your legs.
Okay.
It's, again, everybody is different. I would say skin discoloration happens later. It's more so I can't recover like I used to, right? I was 25 years old. And this is a story from one of the papers. I was 25 years old. I used to run 4 miles a day. I was fine. I'm now 27 years old. I run the same amount, but when I'm done, I can't do that again for 3 more days. Or my legs are just cramping after that. Or, I stand a lot because I'm a teacher, I'm in law enforcement, and at the end of the day, I have to sit down and take my shoes off because my legs are just done. They're exhausted. They're tired legs. those subtle things are really what people should be looking out for. That's what happens first. And then over the course of time, it happens more and more and more. And then it leads to the skin discoloration.
Gotcha. Very cool. So for wellness and pain too, where's the direction you're going in now? I know you said you're going to have a women's health and a men's health. Like, where do you see that evolving to? So
we have evolved into having kind of what we describe as our different umbrellas. So our philosophy is about early detection, proactive preventative care. That's really what we want people to be aware of. The way I describe it, and I say this how many times a day, I don't know, is if you change the oil and you fix the tires, the car lasts longer. It's little things along the way, little tweaks, which can give people better quality of life and a longer life. And so what we have is, under our kind of wellness umbrella, we do things like massage therapy, we do IV therapy, we do weight loss management, do acupuncture, we do sleep studies for sleep apnea. If people have muscle spasms, we could do trigger point injections, things like that. But in our pain umbrella, we have orthopedics, we have pain management, we have neurology, so we could do EMGs and CVs, people have that. We have vascular health, and we're constantly evolving into men's health, women's health. And so we want someone that if they have pain, we can be a source of that. Or if someone just wants to make a change in their lifestyle, right? Come to us, talk to us. It doesn't have to be, at the time of quote unquote injury or condition. Let's think about getting ahead of the game, and we do, like I said, we do a lot of these events. We go around, we set up privacy screens. We did one yesterday in New Jersey. So we do it throughout New York and New Jersey, and we bring ultrasounds to workplace. And so we bring it to municipalities, to law enforcement, to teacher, to corporations. And, it's a lot of education. We go on staff. And so basically it's a way of not only educating people about what they should be thinking about, but a lot of times people say, you know what, I think it's time to make a change in my life, which is great to hear.
Yeah.
And they don't have time to go to the doctor. They don't go for whatever reason. Men are worse than women, it's like, sure. I'll go next year.
Yeah.
But we've gotten in front of people who really need it. I mean, unhealthy. And because they just, we got in front of them, they basically said, you know what, doc, I got to do something.
Yeah.
And whether they come to us or not, we'd love to help them, but there's no mandatory thing. We're not telling you must come to our practice, obviously.
For sure.
But at least it's nice to see people taking that step.
Yeah. Do you see this being like a macro trend in the industry of health?
I think so. I mean, I think it's just good medicine, I mean, whether you're doing, pain, whether you're doing, family medicine, whether you're doing, OBGYN, I just think that it's a good thing to have preventative health, right? Everyone waits until the dominoes fall. It's very, very difficult to kind of reverse that cycle. People can do it, but it takes a lot more work, right? You crash the car, there's a lot more work that has to be done, and things may not work the same way, right? My engine's now clicking. This is not working. My doors. It's harder to pull it back and reverse it versus just maintaining it. But the problem is people have to be ready for that.
Yeah, for sure. And are you hitting hiccups as well with insurance? Like, what do you see happening there?
No.
Insurance is covering preventative?
Yeah.
Oh, that's good.
So everything we do for the most part is covered by insurance. We do a few things like Botox, and again, it's part of wellness, right? How people perceive themselves, I think is very important.
For sure.
There's obviously a huge mental health thing, and part of mental health, we don't do all of mental health, but part of mental health is how people perceive themselves. And so, we do that for people who want it. But, short of that, really, everything we do is covered by insurance.
That's great.
Yeah, because it's medically necessary. And the insurance companies have come around. I mean, when prior to my time, which is crazy, going back to kind of the beginning of the conversation, bariatric surgery was not covered by insurance.
Wow.
People would pay $25,000, $30,000 out of pocket for these bariatric surgeries because obesity, until I think I was in fellowship, I think it was like 2012, obesity was not classified as a medical condition, which is crazy.
That is pretty
because
crazy.
It causes sleep apnea, venous insufficiency,
heart
attacks, strokes, pulmonary embolism. I mean, there's you're at a much higher risk when you're overweight. But now I think there's still things you got to fight. obviously. But for the most part, I think we've come light years from where it has been. But over here, everything we do is covered by insurance.
That's great. It's great to hear. I mean, like for us with PT, preventative still a little not covered. It's like a gray area for that,
which it should be.
Yeah, it should 100% should be, right? Like it's, people will be way better off if they have the preventative care, right? And they'll live longer, which, I don't know, maybe that's the issue, right?
Well, that's,
insurance companies put that into that metric. Yeah. Not to get a little dark, but that's a part of it. Yeah. For the men's aspect, are you guys going to be doing, hormone replacement and stuff like that as well? And what are your thoughts on that?
Yeah, I think it's fantastic. I think, again, we're just getting into it. I think a lot of people are looking for help. Again, getting help early. There's going to be hormone replacement, like you said, testosterone therapy. There's peptides, which have been shown to really improve mental, states, cognition, how people, sharpness, perception. There's obviously sexual function and hair loss and all these other things. Again, it's how you perceive yourself and what you want to be. We're not looking to, make bodybuilders, but it's people who come and say, I'm not who I used to be. And so it's nice to have something where you can kind of help with that. And it's women too. We're going to have hormone replacement as well for women. Also sexual function, things like that. It's very important because, it goes into quality of life as well.
That's awesome.
Yeah.
Did you know early on that you wanted to start a business like this, or?
I had no clue.
No.
I had no clue. Yeah. This was I'm still learning things. I mean, I'm learning things yesterday. I was your typical doctor, right? You go to school, you go to med school, you go to residency, you go to fellowship, you take a job, and that's it. You get a salary.
Yeah.
What really kind of changed the game for me was when I looked for positions, I knew I didn't want to work for a hospital for a variety of reasons. And I just didn't want to be a cog in the wheel and some guy in a suit up north is telling me how to be a doctor. I just never wanted to do that. And so when I interviewed, I looked for private practices and I joined a few. And, they had their pros and cons. Some worked very well, but the administrative staff was not where I thought they should be. The administrative staff was fantastic, but the clinical part was kind of falling off. And so I never really thought about doing it. But at some point I just said, I don't know, there's got to be a better way. And maybe if they can do it, maybe I try. And so, one day I turned to my wife and I said, listen, Michelle, who's also in the practice, Dr. Molina, she's the neurologist.
Nice.
I said, if this fails, I think I'll get a job somewhere. I'm bariatric trained. I'm robotic trained. I can always probably turn around and just get a hospital, but I think I'm going to take the leap. I'm going to jump and I'm going to see what's going to happen. I think there's a better way. I may fail. I don't know. I have no idea how this is going to work. And so I, went home and I played with logos and figured out how to make a phone number. I had no clue. I had no idea. What do you do for a website? I don't know. Yeah. Right. So you start making, who's billing? I don't know how to bill. Where's my office? Right. Who am I going to hire for front desk? This was a learning curve.
Yeah.
And it's still a learning curve. And over the course, now we have 3 offices in Clifton, Woodcliff Lake, here in Ardsley. We're having one in Paramus coming soon. We have PAs, we have multiple staff. We have RNs who do the IV therapy. We have Dr. Temkin who does the oral appliance therapy, which has replaced, CPAPs. But it was just throwing things at the wall. And I said, look, and I've done things that didn't work. Yeah. I think you just have to try as long as you know that you're comfortable with your safety net. That's really what it came down to. When I did it, I didn't have kids. So it was a little bit easier, obviously. And so I just tried along the way. And then, eventually over time, it was just me. I was the one person going to events by myself and setting it up, and it was crazy. And then eventually more staff. My wife joined, more staff. We now have a management team. And so now we have, I don't even know, 7 marketers, and we have, SEO for Google and Facebook and YouTube channels. And it took on a life of its own. So
that's awesome.
It's very cool.
Yeah. Similar with me, man. It's just that I'm learning every day. And I always say the best path or the fastest path to actually like personal development is owning a business, because every day is a different animal.
Yeah.
But it's very, you know, from what I hear, I have people who are in medical school or who are doctors, and it's they say it's not the same as it used to be. Now, would you say that that's really true, or is that an excuse to people who really don't have what it takes, or like, what is that?
I think that they're partially right, but they're partially wrong. I think that there's always a way, right? And people say, oh, it's not what it used to be because of insurances. There's still insurances out there. You know, I think that there's definitely less private practices out there. So people are gobbling up. I also think it depends on your specialty, right? I think that if you are a family medicine doctor trying to make it by yourself, when huge hospital systems are gobbling up people, the person next door to you has a very big budget that their billboard is going to be in front of your door, it's harder. When you're a specialist, it's a little bit easier. But I think that, you know, the mentality definitely has shifted. It's much easier just to join a practice than to develop it. I mean, what we've done, I think, is difficult to do, and you have to have a certain mindset. I think there's still going to be people doing it. I think there's tons of opportunity, but I think you have to be able to balance. And you have to be able to have a business mindset. You know, doctors, unfortunately, and I've preached this since the beginning, you go to medical school, this happened to me, and you go on interviews, you don't know what to do. A job, right? You don't know what to do. You don't know what a normal salary is, right? You've been institutionalized, basically. And so you just fall into that institutionalization. And so the business aspect is not taught, which is very unfortunate. There should be business classes taught in medicine. There should be things about business. There should be things about, you know, taxes and corporations and what are you going to do, whether you use it or not. But I think a lot of people just don't know. And so they just continue in that very, I don't want to say easy path, but the simpler path of just joining another system, then kind of breaking out and being like, let me be the business person as well. Because to balance that's not easy. You have to have a certain mindset. And some people are not business people.
Very true. Very true.
So
did you foster yours over the years, or did you?
Over the years.
Yeah, that's how you created it.
Yeah, you know, I was there, you know, I didn't know anything about it.
Yeah.
I just saw, you know, through the private practices, you know, kind of like, what are they doing? You know, I don't know. What's billing? I don't know what billing is, right? You do a case. You go to surgery. You do a gallbladder. Okay, you check on the patient, right? You discharge them. You see them in the office. I don't know what CPT code that is. I don't know what you bill. I don't know how you submit a claim. That's over there. But, you know, if you're willing to learn it, you take it on little by little. And again, you try it. Like I said, I failed 10,000 times. I think that's the only way to learn. And, you know, over the course of the years, like I said, you know, you just learn it, or, you know, it's just a constant progression.
Sink or swim, right?
Sink or swim. But I do it, you know, men's health and women's health. I'm learning as we speak, literally. I'm putting protocols together. What should we do? You know, I've seen this program, I've seen that program, kind of like this, kind of don't like this, but, you know, I didn't know this 3 months ago. Yeah. So it's a constant evolution.
Do you have help in the back end for the business? Because if you are front running all of that stuff, it's got to be challenging to have the business side as well, right?
Yeah. So we do. We have a lot of help. So we have a management team. I'm part of it, obviously. And we have help in all respects. So clinically, obviously, we have PAs, we have doctors, we have staff, we have marketing teams. But from the business aspect, we have a whole back end now management team to do it. Yeah, because again, that's one of the other things. It's very hard. At the beginning, you could do it yourself. As you grow, you need to be able to also put your resources in, because if you don't, you know, it's a very heavy load for one person.
Yeah, you get burned out.
Yeah. And so you have multiple locations. So, you know, to do it yourself it's hard to do.
It'd be impossible.
It'd be impossible.
You know, you need a team. You need a team.
And you have to have trustworthy, which again, not easy to do. I've had, you know, experiences, and it's very, very tricky, but you have to have the right team. You have to have people you can trust. You have to have people who are good clinically. And again, you know, you go through your ups and downs and you figure out. Right now, we're very fortunate. I got to say, our staff is amazing. We've created, which I think is very important, a family-like atmosphere. Don't get me wrong, we work, but it's unbelievably collegial, mutual respect. Nobody looks at Dr. Rod is the boss. Shh, he's coming through, you know, stomping my feet and whatnot. It's just not the environment we want to create. You know, everybody's kind of even. We want everybody to kind of speak up and tell us, hey, am I doing something wrong? You know, I think that's an important culture we've been trying to do, which I think is very different than a lot of practices. I've been in practices where, you know, you don't speak to the head surgeon. You just don't, right? Unless you want your head chopped off, you know. I'm not that guy. I'll never be that guy. There's no reason for it. You know, I think everybody has something to give, something to, you know, that you can learn from. You know, I don't know everything. I'll be the first one to say it. You know, I know what I know and I don't know what I don't know, but you constantly have to learn from people, and you can learn from your front desk, and you can learn from your practice manager, and you can learn from tons of people. You know, it's impossible to know everything.
Yeah, I totally agree. Couldn't agree more. Do you guys have like a set of core values you follow?
Yeah, I mean, again, I think the core is that, you know, is respect. It's patient first. You know, I've told my staff that, you know, the way we should treat this is kind of like a hotel industry, right? You have to be, you know, respectful of people. We want to make sure we follow up with people, but we want to provide good medicine, you know, and I think that core also goes back to the early detection, preventative health. You know, let us kind of educate you and try to guide you back. And again, you know, there are very few people who are hesitant with that. And it is subjective and patients have to be on board. But, you know, that's really our core. You know, if you can do these little things along the way, then it just lasts. And, you know, even things like, you know, vein treatments, right? So ablations, which I do, radiofrequency ablations, they're 8-minute procedures, very quick. They're permanent, they're covered, they get picked up, they get dropped off, it's fully concierge, we do it at a center. By just doing that little tweak, people are able to do more. So they can run more, which means they can exercise better, which, you know, that rock goes down the hill the right way, so to speak. And so it's these little things that happen. Yeah, and so but it's those little tweaks that happen. So again, we have I do a lot of vein ablations for people, and so those little tweaks allow people's legs to feel better. We actually have had very interesting stories. You know, we listen to our patients. So there was a gentleman who was 55 or so. We had seen him. He was undergoing evaluation for a hip replacement. Okay. He came in for a variety of different reasons. And, you know, we said, hey, listen, you're having hip pain. Do you want to get an ultrasound to look at your veins? Veins? What are you talking about? Doesn't make any sense. So it's go into the whole venous insufficiency spiel, right? No, it's not just this. It can cause this. He's like, okay, it takes 8 minutes. It's right here. It's very easy to do. Veins were huge. I said, listen, this may or may not be all of your reasons, but you clearly have venous insufficiency, and this can be part of your pain. Before you undergo this very big surgery with a huge recovery, that's a very different ballgame, do you want to try a little tweak along the way? It's an ablation, it's quick, it's a little poke, 8-minute procedure, done. So might as well give that a shot before. Okay, that makes sense. And this is also why we educate constantly, because people don't know about this. Got it done. That was his pain.
Wow.
He never needed a hip replacement.
That's amazing.
So again, it's those little tweaks. So now we have pain management. So, you know, epidurals, if someone has a herniated disc, sciatic type things, we can actually do these little injections and these little things along the way so that they don't get their huge spine surgery, you know, and, you know, we see huge results because of it.
It's fantastic.
Yeah.
So for people who are interested in doing something like you, what do you think is the one trait they should start to foster and really build on?
You mean in terms of doctors, businesses, or
both? I mean, this is, you know, accomplishment of both.
Yeah.
Someone who, let's say specific, someone who's in medical school is like, yeah, I want to open a business eventually.
So I would say, don't be scared. Prepare yourself, right? Both, you know, emotionally, financially, right? There is, you will go down before you go up, right? It is a roller coaster, and it may not always work. But I think, you know, prepare yourself, get a little nest egg, right? That's what I did, right? You join some practices, you get something in your financials so that, when you're just spending and not making, you have something there. You got to protect yourself. But I would say, learn everything you can do. And, medical school is great, residency is great, but it doesn't teach you everything. I would say find a colleague, a mentor, an associate that you can sit down and can maybe kind of go through these things with you. Ask the questions. What is this business? How did you do this? Where did you start? Right? Because again, I learned along the way and I just kind of picked up things and nobody really taught me. But I think that if I had asked questions earlier, and again, I didn't even know, but if I had asked questions earlier, I think that maybe I would have been more inclined to even start this earlier. But most people in the field are very nice. They're not going to say, stay away from me. I'm not going to teach you my business. You know what I mean? So I think, if you had someone, who came up to you and said, hey, Joe, I'm really thinking about this. I'm going to join this monster corporation, or I'm thinking about maybe doing it myself. I'm sure you'd say, hey, let's sit down. Let's talk. What do you want to do? Do you understand the good, the bad, what you're in for, right? This is the kind of things. I think it's cool to mentor people and say, this is what it takes. This is what I did. You don't have to do what I did. There's many different ways to do it, but I think you got to ask.
For sure. So learning and mentorship. That's awesome.
And again, not being afraid to take that leap. It's a scary leap. Yeah. It's a very, I'm sure it's a scary leap.
That's for sure.
But like I said, I personally, I would have a safety net there, right? I'm not the guy who just leaps blindly. Yeah. I would say make sure you have something there. But don't be afraid to take that leap. Love it.
Yeah. If people want to find out more about you or the practice, where can they go to? And then any closing thoughts?
Sure. So we have an office. We have 2 offices in Jersey right now, Clifton, Woodcliff Lake, one in New York and Ardsley, Paramus coming soon. They can reach us various different ways. So our website is wellnessandpain.com. Everything's there. But our main number is 844-566-2723. Or they can just email us at admin, ADMIN, at wellnessandpain.com. Our team gets back to them immediately. And so, anybody who wants to come in can also obviously come in. Last thoughts, I want to thank you again today. This has been amazing. I think it's important for the medical community to kind of, do this, kind of learn off each other, know who's out there, right? We were talking about referring to each other. I think it's important for, the community of medical professionals to kind of help each other, because it is a tough world. And so I think it's very important. I think, for patients, I think it's important to just think of today as the day. You can do it, get better, but there is help out there. You don't have to do this alone. There's a reason why these practices exist. If everybody could get just better by themselves, they wouldn't need us.
For sure.
Right? So don't be afraid. Come to us. We're here for you.
Awesome. Well, thank you very much. This was great. Appreciate your time, Dr. Arad.
Thank you. Appreciate it.
For watching, guys. If you got any value, please share the show. This was a good one. If you know any medical doctors, people in medical school, definitely share it to them. This guy is impressive. So you want to tune in and share it. Thank you.
Thank you so much.